much for joining us this afternoon. For those of you I haven't met yet, my name is Rachel and I'm the Program Director at Cancer Support Community Pasadena. And we are so excited about this workshop today. Like it says in the title, it's going to bring smiles and tears and everything in between. So I have just a couple of admin announcements before we get going. First off, we are trying to take accurate attendance for this workshop today. So if your Zoom name isn't clear to us, we may private message you just to get your full name for attendance purposes. We're also going to keep you muted for the duration of the presentation. There will be an opportunity at the end for questions and answers, but there's a lot of great content to get through. So we'll ask that you hold your questions until the end, or if you don't want to forget your question, feel free to type it into the chat and we will ask it at the end for you. Also, we are going to be recording today's workshop, but only the presenter's face will be shown. No other faces will be shown on the presentation, but do note that if you unmute yourself, then your voice will be heard on the presentation. So if you prefer to not be heard, you can always type your questions and comments into the chat. And that is all in terms of admin. So now I would love to introduce our presenter today, Rose Nielsen. She is a volunteer at Children's Hospital Los Angeles with her certified therapy dog, Blondie. They have provided hundreds of hours of support for patients at CHLA. And Rose authored a book called Blondie and the Hidden Treasure that raises money for dog therapy programs. And she generously donated books for everybody who is registered for this program today. So I'm sure all of you got email communication from me, but feel free to pick up a book at our office during business hours this week. And of course, email me if you have any questions about that. But we are so appreciative of that kind donation and we are so excited for the presentation today. So with that, I'll hand it over to you, Rose.
Okay, thank you so much. I just want to go through, you know, everybody is aware of HIPAA regulations. So all the photographs that you will see today have been approved by the hospital. If the child is under 18, the parents have signed permission. If the child's over 18, the hospital has, we've gotten permission from the hospital to use the photos. Some of the photos are not quite as clear as I'd like because some of them came from the hospital and they did not come directly from my own camera. When I got Blondie as a puppy, I had no idea what was in store for the two of us. I took Blondie. She was an amazingly calm dog. So when she was 3 months old, I took her to Griffith Park for training classes. So I felt that so she could socialize with a lot of other dogs, which I felt would be helpful. By the time she was 8 months old, she had passed everything, including good citizenship class. And it was one of the instructors who came up to me and said, Blondie would be a marvelous therapy dog. And my question was, what is a therapy dog? So what really is the difference between a service dog, an emotional support dog, and a therapy dog? Well, I think we're all familiar of one category under a service dog, and that is a guide dog. You know, and we're very lucky to have Guide Dogs of America up here in Sylmar, which is a fabulous organization. And you know, they're specially trained to work with somebody who is blind or visually impaired, enabling the person to move around safely. So a service dog is any dog that is individually trained to do work or perform a task for the benefit of an individual with a disability, including a physical, sensory, psychiatric, intellectual, or mental disability. Now, if a dog was a pet prior to training, it cannot be truly used as a service dog. And it's a very gray area because a lot of people try to use, you can go online and order a vest that says service dog for $65. And then people try and take this dog in places where they really should not. An emotional support dog provides support just for a person with mental stress. They are not certified in any way. And a therapy dog, yes, we are tested every 2 years and we go to hospitals, schools, and group environments, but we would not be, I could not take Blondie on an airplane, even though she has paperwork that says she is a therapy dog. Only the animal that's allowed on an airplane is a true service dog. Now there's many kinds of different service animals and we are, you know, of course we're familiar with guide dogs, but there's the dogs that help people who can't hear, that help people who can't get around. The dogs that are trained to alert people when there's a drop in blood pressure or something with diabetes. A dog is taught to either lay down when they see something is going on, or stand up next to his master, put his legs up on his master to let him know something's going on in your system and you need to go get some medicine. The most common breeds of service dogs are Labs, Golden Retrievers, and German Shepherds. Now, they used to use a lot of poodles, but because of all the maintenance of a poodle, it's not the most practical dog for a lot of people to have. The reason why dogs are so amazing is their sense of smell. They have 300 million olfactory receptors compared to our 5 million. And so a dog really navigates the world through their noses while we navigate the world through our eyesight. And now generally a child will not be given a service dog until they are 12 years old. And the reason for that is because they don't want the dog to be treated as a pet. It's a working dog. And there are a lot of cases when children are allowed to have dogs younger, absolutely, because they truly need them as a working dog. Now, as you all know, it wasn't that long ago that people were taking all kinds of animals on airplanes. And the problem was, since there's no certification of a service animal, and they've gotten now stricter on that since, because of HIPAA regulations, they could not say to you, why do you need this animal? You need it for health reasons? And so that became a real gray area. Now, they have now changed a lot of those rules, and they're not even allowing emotional support dogs on an aircraft. And now a service dog, if you go through a service dog training, your dog will have a piece of paper that says it went training for a specific purpose, like for diabetes or for high blood pressure. And then therefore your dog can go on an aircraft and into restaurants and into stores. A therapy dog is what Blondie is, and she is trained to bring comfort and joy to those in a hospital, school, or group environment. Hospitals do not allow cats. They only allow dogs at the hospital. And they do allow small horses. There are 3 kinds of therapy dogs. There's a therapeutic visitation dog, the animal-assisted therapy dog, and the facility therapy dog. Now, Blondie is a therapeutic visitation dog, and that's by far the most common. This is Blondie. We are out at Santa Teresita in a senior center. And here she's out there working. We also have worked at evacuation centers during the fires because they love to have dogs come down because so many people have had to put their dogs in a shelter while they go to an evacuation center. We've worked with a lot of children with special needs and a lot of children with autism. So an animal-assisted therapy dog is an animal that would work in a physical therapy facility and that would actually help the therapist. Maybe they work a lot with children to motivate children to walk and to use their hands and to do certain things. Now, we're very fortunate at Children's Hospital because Blondie gets to work also in physical therapy. And the bottom left picture of Blondie is a little girl was trying to learn her coordination once again with her hands. So she put bows and stickers on Blondie and had to put socks on her. The photo on the right, Blondie is with the patient. It was the first time she walked after having cancer in her leg. And so the dogs come in very, very handy for physical therapy at the hospital. And a facility therapy dog, I'm sure all of you have been in a nursing home where there's a therapy dog that lives on the premises. So that's what a facility therapy dog, they live at a facility and they are generally managed by a member of the staff. So therapy dogs must be very well tempered, they have to be well socialized, and most importantly, they have to be certified. Blondie is tested every 2 years to make sure that she still meets the qualifications of being a therapy dog. And believe it or not, when the dogs take the test, only 50% of dogs pass this test, even if they're working dogs. Yes, you can retake it. So the qualifications for a therapy dog, it must live at the owner's home. The dog must be at least 1 year old before they can take the test to be a therapy dog. They cannot be fed a raw protein diet. The dogs have to be current on all vaccinations, including rabies. Every year, Blondie has to have a yearly physical, including a fecal sample. And if a dog would be on medication, like for an ear infection or something else that's going on with them, when they're on a medication, they cannot be visiting at the hospital. The test preparation for pet partners is pretty intensive. I was very fortunate. The lady at Griffith Park who said that Blondie needed to be a therapy dog also had a therapy dog. It offered a class for training your dog to be a therapy dog, which worked out perfect because Blondie was only 8 months old and she couldn't even be tested until she was a year. So it was 12 hours of training, and we went to settings with like lots of different people. We went over to the Glendale Galleria, to the parking garage where we did steps, just up and down the steps for them to learn how to do steps and not be scared of them. We went to the Americana and walked so she'd be good around people. We went to outside restaurants in Montrose where they had to sit and ignore food and be there with other dogs. We went down to the LAX airport so the dog could hear sirens and baggage and just the commotion at an airport so that they wouldn't react, because at the hospital a dog can't bark. And so if there's a sudden noise or something, you don't want a dog barking at it, or you don't want them howling at a siren, because you're at the hospital and you can hear a helicopter come in on the heliport and your dog can't start howling when it hears this sound. And then the final class, they had a setup and they had people with wheelchairs, skateboards, and people arguing and making strange noises to just get a dog used to all this so they would not react. And then on top of that, I was required to take a 6-hour course on learning how to deal with various situations that you encounter as a handler of a therapy dog. Like if somebody's in a wheelchair, how do you approach him? What's the best place to have your dog? If you go into a child's room and they have, an airbed mattress, how to get your dog to sit up in a chair instead of on the bed, and just different situations like that. And it was a super helpful class. So the test takes about 45 minutes. And I must be honest, the first time I had Blondie tested, I was super nervous because a young lady right ahead of me had failed. And I thought, oh, no. So you have to do all the basic things. You have to walk your dog. You have to heel perfectly with no pulling, sit and stay, lay down. And then there'll be like 2 or 3 volunteers who will come over and like pet your dog and kind of pull at her hair and play with her ears. They put their fingers in her mouth to make sure that the dog just kind of ignores it all. Then you'll be walking and they'll drop a bedpan behind you. And it's okay if the dog turns around, but the dog can't bark. We also, a lady came up on a walker and she had a piece of hamburger pizza in her hand hanging out. And I had to tell Blondie to sit and ignore. And we also have to walk by, this was, for Blondie, maybe one of the hardest, because they had a red ball on the floor, which is, Blondie has a red ball at home that she loves. We had to walk by a toy and she could not make a move towards the toy. You also have to, you're walking with your dog on your left side and somebody else comes walking with a dog on their left side. You stop and you have to greet the person, but your dog can't go past your leg to go see the other dog. So it's kind of learning to ignore a neutral dog. So after after I was all passed through that, then every hospital, I worked both at Huntington Hospital and Children's Hospital the first year. And both hospitals required like 15 hours of orientation and supervised visits where they go around with you when you're doing your first visits to teach you how to get your dog up on the bed and what to do. They also, you pass a background check, and then every single year, I have to take the regular test that every employee at the hospital has to take. I have to have an annual TB test and an annual flu vaccination. And now, normally if I was in person, whoever would come up with this would get a present. Did you know that research has shown that therapy dogs can lower blood pressure, decrease stress, calm heart rates, increase mood boosting endorphins, and they really do enhance the patient's hospital experience. I had a very interesting experience with the blood pressure one day. I was in a child's room and the blood pressure was extremely high. And they just said, all we need is a dog to be in the bed with her, just to calm her down. And it was absolutely amazing. Her blood pressure in a matter of about 20 minutes dropped 28 points. Had I not been there to see it, I don't know if I would have believed it, but it was incredible. It just, these dogs have this amazing sense when they're with somebody, how to behave and what to do. So while visiting a hospital, all dogs have to have a bath within 24 hours prior to the visit. We carry with us in our apron hand sanitizer, which anybody who touches the dogs, their hands are sprayed before and after. When we go into a room, we spray the patient's hands and any relatives or people in the room that want to touch the dog. We also, before I go into a room, I sanitize my hands, and also when I leave the room, I do. We have dog cards that we give every child. I always carry an extra leash. So I have a 2-foot leash and then a regular long lead. And the reason for the 2 leashes is because so many times you get into a room and they're trying to get a child out of bed to walk or to do something. And if you can say, well, why don't you take Blondie for a walk? You give the child the long lead and I take the short lead. The child thinks that they're totally in control of the dog because they have the leash, but we really have control. We bring a gentle brush because a lot of the kids want to brush and play with the dog. Dogs wear bandanas at the hospital. And here's Blondie's name tag that's on her bandana. The reason they don't wear a vest is because if a dog had on a vest, a child could really pet the dog, and the kids love to pet the dog. We always carry a towel in case when we take our dog out to relieve himself before our visits. If the feet get wet, we want to make sure that the feet are dry. We always have a cell phone with us because probably 1 in 3 or 1 in 4 times I'm at the hospital, I will get a text message from somebody who will say, we need it. We would love to have a dog in this room. Could you please possibly come? And then we always do carry treats because every child wants to know what kind of a trick the dog can do. And so it helpful to have those treats on hand. So we're very lucky at Children's Hospital LA because dogs can go almost everywhere. We go in the lobby areas. We go in the pediatric intensive care unit, all floors, including NICU. Now, they only approved NICU about 3.5 years ago. We do not go in the rooms in NICU, but we go down the halls for the staff and for the parents. A lot of the parents come out of the rooms to see the children. We do inpatient and outpatient rehab, and then we also do any type of special request. Blondie works a fair amount in the neurology clinic because there's certain patients that every time they come, the doctor asks if Blondie can be there to help them through their procedure. So when we go to the hospital, we stop at the nurse's station at the beginning and we get a number of sheets. We always lay a sheet on the bed, or if the child gets in a chair, we put the sheet on the chair. We only go into rooms with blue signs because that means the child is not contagious in any way. But if there's an orange or a green sign on the door, we can sit outside the door and the child can see the dog. We just don't go into the room. And then you do have this symbol on doors, and that means that a child probably has less than 48 hours to live. And in fact, the last time that I was at the hospital visiting with Blondie was on March 15th of last year, right before the COVID thing shut the hospital down on the 17th. We had special requests to go into one of these rooms to help this little girl. And it's just very rewarding to see how wonderful a dog works with these children. So the dog therapy program at Children's is really quite large. As of a year ago, we had 127 dogs. Every dog has to visit at least twice a month to stay qualified. Last March, we would have celebrated therapy dogs on duty every single day for 5 straight years without a single day missed, with an average of 5 dogs per day on campus. Logged 1,200 patient visits each month, which is a lot. It's kind of interesting. At Children's Hospital, there's no age, breed, or size restriction. Our smallest dog is 4.5 pounds, and the largest dog is 175. The largest dog was the brown dog Bonner, but he has since passed away. He was 210. Also, a dog can test at any age to be a therapy dog. So to say a dog can't be a therapy dog past the age of 8, some people don't even start till their dog is 8. Because their dog just isn't calm enough or ready to be a therapy dog. Now, every year we have Dog Appreciation Day at the hospital, and this particular afternoon, we had Dog Appreciation Day. There happened to be 8 Goldens in the group. If we were there in person, I'd ask you which dog is Blondie. And there she is. But since you can't see Blondie in person, you'd have no clue. So one of the fun things at Children's Hospital is they let us dress our dogs up in costume because it makes the children so happy. Now, Pet Partners really doesn't like that, but it's wonderful that they do it. So here's just Blondie in some costume. So when we were at the hospital, we encounter so many different situations, and some of them are pretty tough. I had been volunteering a very, very short time, and I knocked on this little girl's room, and when I knocked on her room, she was crying. She was a teenager. And I said, would you like a doggy visit? And she said, no. I said, you know what? Blondie and I will just stand here by the door and talk to you. And within probably 3-4 minutes, she said, oh, can Blondie please come in? And then right away she said, oh, can Blondie get up in the bed with me? So Blondie got up in the bed with her. She stopped crying, hugging Blondie. And about 15 minutes later, there was a knock on the door. And it was a group of 4 doctors. And the first comment when they walked in the room, they said to the patient, we've never seen you smile. And I excused myself from the rooms. They introduced themselves as comfort doctors. I excused myself from the room, and they found me out in the hallway about a half hour later, and they told me that they were preparing her for death and that she just loved having Blondie there. And if Blondie and I could please come back and visit, which we did in a couple of days, but then I had to go out of town, and the next time I was there, she just wasn't there. Then I had this little girl. I went to her room to visit, and they were trying to teach her to walk again, but she had to take a shower before her physical therapy. And so I said, okay, you take your shower. I'm going to give you Blondie's card, and I promise you I'll be back. Well, I went out in the hallway, and I did get a little text message that said, can you please come to this room in 20 minutes? Well, it was the same little girl's room, and it was the physical therapist. And I went back to the room, and the little girl was so excited about having Blondie's card that the nurses had to get a Ziploc bag so she could take it in the shower with her. And what they did was she could go home as soon as she could move from her bed to the commode, and they just couldn't get her to walk. And so we had Blondie lay on the floor, and she hung her feet over the bed with bare feet, and they moved her feet back and forth on Blondie's fur. And they did this, it seemed like forever. It was probably only like 10 or 15 minutes. And believe it or not, that little girl, after moving her feet back and forth on Blondie, got up and was able to get over to the commode. And the great thing was that meant the little girl got to go home. Then also Blondie and I were walking down the hall one day, and there was this young man who we'd known for quite a while, and he was just way too weak to bend over and pet Blondie. And I said, you know what? Let's just go to the end of the hallway, and I'll lay my sheet down, and Blondie can hop up, and you can pet her. And he was sitting there petting her, and he said, you know, if you have a chance before you leave, will you come into my room? And I said, absolutely, I'll be there. And so we went back to his room towards the end of our visits, and he had Blondie up on the bed with him, and they were talking. He was hugging her. And his comment to Blondie was, Blondie, I sure hope to see you again, but if not, I'll see you on the other side. I'm just getting there first. Then we a number of times we get called into the rooms when a child is not going to make it. And this one family, the dogs meant so much to her that they, on her last few hours, they wanted to have as many dogs in the room as they could, but there's only one dog allowed at a time. And Blondie was probably the 7th dog that visited her that day. And it's absolutely fascinating. Blondie got on the bed, and she just inches her head up and kind of laid on the pillow next to the little girl. And the mommy put her hand over on Blondie. And the little girl slightly moved her fingers, and the parents said, you know what? She knows exactly what we are doing. And this family has started every single year. They have an annual fundraiser for the dog therapy program. And we always take a bunch of dogs to the program because they just said the dog made their lives so wonderful at the hospital. Then I had one little patient one day. He was probably 5 years old. And he just, after being with Blondie for about 15 minutes, he said, you know what? Blondie's my new best friend. And he says, can I ask you a favor? I have a really naughty dog at home. Could I just trade you for Blondie? And I said, you know, boy, I would love to trade, but Blondie loves coming to the hospital to visit, and you have to be 18 to bring her. So I said, when you're 18, you give me a call and we'll work it out. And that's all he needed. He was so happy. 2 years ago, you're going to find out later in the presentation that Blondie is married, and all the kids at the hospital know that she's married because it's on the Children's Hospital website. Well, 2 years ago, Blondie was bitten by a rattlesnake and had to have her hair shaved on her leg where she had an IV. And we were in one of the patient's room one day, and the patient was very curious about what happened to Blondie's leg. And I said, well, Blondie had an IV just like you have an IV. And they had to shave her leg. And she looked at me and she said, I sure hope that her husband sent her flowers. So obviously, Daddy must do a good job of sending Mommy flowers. 2 years ago, I got a call from the hospital that they wanted me to meet a parent in the lobby. They had gotten word that their child was only going to live like less than a couple days. And the mother met me down the lobby and she said, you know, at first, all we did was cry. And she said, then my daughter made the comment to me. She said, Mom, we're all going to die sometime. I'm just going to go first and get things ready for you. And the mother decided that from then on, there were going to be no more tears. So she asked her daughter, what would you like? And she said, can Blondie come visit? And so the mother gave me kind of the background. So Blondie went into the room, and pictures you're going to see later, the little patient said, oh, she was showing all her family, you know, you got to see Blondie in her wedding dress. You got to see Blondie dressed like this. And for an hour, the mood in the room, I mean, literally went from tears to just smiles. It's absolutely amazing. So volunteering with Blondie is an incredibly rewarding experience, but sometimes so very hard on the heart.
This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine, let it shine, let it shine, let it shine.
Well, this is a really fun story. I got a call one day at the hospital, and if I could please go to this one room, because this little boy who was fighting cancer, every time he had to go for treatment, he would sing the fight song by Rachel Patton. And his dad said, you know what, son? If we record this song maybe and send it to her producer, maybe she'll come visit. But he just kind of needed a little moral support. So somebody from the hospital with a guitar showed up in the room, and he wanted to have Blondie at his side while he sang the song for her. And the great news was, 2 weeks later, Rachel Patton came to the hospital. Now check out his cute comment here.
You are so amazing. Oh my gosh, you have a beautiful, beautiful voice. What do you think, Monkey? I have a question. Can I have your autograph?
Is there anything more precious? Ooh. So when children have bone marrow transplants, they're used to having dogs, and they can't have dogs in their rooms. So what we do is we put little posters around our dogs' necks, and the hospital will make a big poster and hang it up in the child's room so they visually can have dogs. But as the one good part about this COVID thing is we're doing virtual visits with an iPad. And now that we know that the nurse can go around to the rooms with an iPad, they're going to be able to have virtual visits, even though they can't have the dog in person. So maybe that's one good thing that has come out of COVID. And teenagers at the hospital need dogs too. I mean, a lot of times we think that at Children's Hospital, it's only little children, and it isn't. I mean, I've seen patients as old as 25 years old, because if they start treating somebody, they stay with them. They do not leave. This is a wonderful little story. This is Gabby, who, was in and out of the hospital for 2-3 years fighting cancer. It's a little girl who had cancer in her leg. And every time she came to the hospital, her mother had to put up a string and hang up all her dog therapy cards because she loved the dogs. And I didn't realize this, but Blondie was the first dog that helped her walk after her surgery. Well, they were so thrilled with the dogs that the mother, I don't know if any of you have heard of Bark Box, but they send a box every month filled with toys and treats. The mother wrote the Bark Box people and said, we have about 10 dogs at the hospital that we would love to give a Bark Box to, who have helped our daughter get through this tough time in her life. And the great thing was they sent Bark Boxes, and the dogs are not allowed toys at the hospital. But this one day, Blondie was allowed to be with the patient and be up on her bed for like an hour playing with all kinds of toys. It was a super special day. Now, this little girl, Chloe, had known Blondie for about 1.5 years when all this happened. We were in the lobby one day. Blondie's on the right, and Blondie was meeting a special needs patient for a special request. And Luke on the left was doing his supervised visits, which you do when you start at the hospital. And the two dogs walked up to each other and kissed. It was the month of February. The hospital posted this photo online and put "Love is in the air." Well, the next time I was in Chloe's room, Chloe said to me, "Why didn't you tell me that Blondie had a boyfriend?" And I said, "How do you know that?" And she says, "It's on the website." Well, about 2 months later, we got a call from the hospital that said Chloe had arranged for the two dogs to get married in the Interfaith Chapel. So here's what followed.
Going to the chapel and we're gonna get married. Going to the chapel and we're gonna get married. Gee, I really love you and we're gonna get married. Going to the chapel of love.
Now, the last picture with the champagne glasses and the rings, well, what happened was, of course, there's a wonderful post on the hospital website. If you look up CHLA Puppy Love, you can read their love story. But anyway, the little kids want to know when the puppies were going to be born. Some of the older kids were very concerned that Blondie did not have a wedding ring. Well, then what happened was Luke got a job, and about 1 year later, we renewed our vows at the hospital and had a second wedding. So now, all the kids know the dogs are married. So now every time they come to the hospital, we try and dress them up in some outfit. In fact, today I'm just making their new outfits for when they go back, and they're going to be doctors, DOGTOR, Dr. Blondie and Dr. Luke. So here's some of the outfits that they wear.
If we took a holiday, some time to celebrate, just one day out of life, it would be so nice. We come such a word. We're gonna have a celebration all across the world. In every nation, it's time for the good time. Forget about the bad times. One day to come together to release celebration.
time to celebrate. Come on, let's celebrate one day out of life. Holiday, it would be so nice. We took a holiday. Oh yeah, some time to celebrate. Come on, let's celebrate one day out of life. Just one day out of life. It would be so nice. You can turn this world around and bring back all of those happy days. Put your trouble down. It's time to celebrate. Let love shine, and we will find a way to come together to make things better. We need a holiday. We took a holiday. Count your days. Some time to celebrate.
And after all of our visits, that picture at the end, the dogs always go down to Starbucks and get their puppy chinos. And the children all know that on Tuesdays at 1 o'clock, if they want to come down to the lobby, they can help give the doggies their puppy chinos. This is a clip that was done by Telemundo on therapy dogs at the hospital. So that's the apron we wear when we're at the hospital, and you can see Blondie's bandana. I've laid a sheet on the bed, and I spray the patient's hands. The nurse here is explaining how like the dad was saying, every time our daughter has dogs, her blood pressure, her pain level, everything goes way down. Like a child will say their pain level is at a 10. And if they have a dog in the bed with them, it normally goes to a 5 or a 6. These dogs help children after surgery, putting them to sleep. Here she's just showing the pain chart. And the dad's explaining how wonderful it is having these therapy dogs. Now, one thing, when you go into a child's room, you can't ever assume anything. You can't assume their age. And you also can't assume whether they're a boy or a girl, because a lot of these children don't have hair. So what you do is you always ask the child their name and how old they are. And when you leave a room, you never say to a patient, have a good day, or anything like that. What you say is, thank you so much for letting Blondie visit, or you've made our day. Blondie is so happy. You're such a great petter. Or thank you for taking Blondie for that walk down the hall. So you always leave with a very positive statement. So since COVID, our lives have really changed, and we're visiting Luke and Blondie. Luke lives up in Camarillo, and we visit via iPad. And sometimes it's just Luke and Blondie, and sometimes it's Luke and Blondie and another dog. And it's really changed. And we had adorable Easter Bunny outfits for them last year that we didn't get to wear, so we had them deliver some toilet paper to some people this last year. So anyway, and then Blondie got to dress up a few times with the grandchildren. So here's just a few photos of what a virtual visit looks like. You don't show the patient, of course. The dogs just generally sleep. They don't quite get what's going on. So here's our dogs in their Easter outfit doing their job last year. And of course, Blondie loves to dress up with the grandchildren. So we still dress her up. At graduation, we dress the dogs up because so many kids could not go to graduation ceremonies. And so we did the graduation things just to make the children happy. So, I mean, truly our dogs just offer unconditional love and understanding at the hospital. And I wish you could see Blondie in person, because when they interact with a patient, when we walk into a room, Blondie immediately knows if she's seen that child 6 months ago. And it's absolutely fascinating, these dogs. They just pick up so much more than we do as humans. This little boy, absolutely, before he left, he says, I just have to kiss Blondie goodbye. So I just had to end it with this, because I don't think sometimes we realize what an important role dogs play in our lives. They're so important to us.
So God made a dog And on the 9th day, God looked down on his wide-eyed children and said they need a companion. So God made a dog. God said, I need somebody willing to wake up, give kisses, pee on a tree, sleep all day, wake up again, give more kisses, then stay up until midnight basking in the glow of a television set. So God made a dog. God said, I need somebody willing to sit, then stay, then roll over. Then with no ego or complaint, dressed in hats they don't need and costumes they don't understand. I need somebody who can lift spirits with a lick. Somebody who, no matter what you didn't do or couldn't take or didn't win or couldn't make, will love you without judgment just the same. So God made a dog. God said, I need somebody strong enough to pull sleds and find bombs, yet gentle enough to love babies and lead the blind. Somebody who will spend all day on a couch with a resting head and supportive eyes to lift the spirits of a broken heart. So God made a dog. It had to be somebody who'd remain patient and loyal, even through loneliness. Somebody to care, cuddle, snuggle, and nuzzle, and cheer and charm, and snore and slobber, and eat the trash and chase the squirrels. Somebody who would bring a family together with the selflessness of an open heart. Somebody who would bark, and then pant, and then reply with rapid wag of tail when their best friend says, let's go for a ride in the car. So God made a dog.
So when you really believe in something, and I have to be honest, once I started working at the hospital, I've never, ever done anything that's rewarding. What inspired my book was I was on the elevator one day, and a gentleman said to me, it must be amazing to do something when all you do is make people smile. And he was so right, and therefore I wrote a book to hopefully raise money for dog therapy or anything else. I'm hoping you will all get a book. And if you love the book, it'd be great if you sent a little check or support for the cancer support community in Pasadena, because the reason we did the book was just to help different nonprofit causes. And I've also done a lot of biking to raise money for City of Hope, for Children's Hospital. And so anyway, I hope you can all get a book. So if you have any questions, I'm here to answer. And if anybody would like a book sent to them, give Rachel your address and I'm more than happy to send you one.
Thank you, Rose. And I think we had one question in the chat at the beginning of the call. Someone asked why can't the dog be on a raw diet, or a therapy dog? Why can't they be on a raw diet?
Because they're afraid there's bacteria in the food.
Okay.
To me, it doesn't make a lot of sense, but that's one question they always ask you. And if you would say you gave your dog something that's a raw diet, you would flunk the test.
Okay.
I think it's because of the bacteria. It doesn't, I think it's silly, but.
Okay. Someone asked, do you ever go to CHOC, Children's Hospital in Orange County?
I have not. And mainly because I go to Children's probably 6 times a month. And then I do other calls at other places. I try to get to Santa Teresita. And it's a time thing. It's a time thing. Mm-hmm. But it's if anybody ever wants to do it, you have no idea. And some people say, well, it's got to be so hard. And there are times it's very, very sad. But you know what? The amazing one is the dog. And a dog really, if they have, it's quite interesting. If they're dealing with some really sick patients, 2 hours is really their limit. And when we're headed home, Blondie will go to the back and lay down if it's been a tough day. And, they know a lot more than we do about what's going on. And, but it's just fascinating to watch a dog, how they respond.
Sure. And then someone asked, they said that they're interested in their golden retriever becoming a therapy dog, and they were wondering if you could tell them about the training.
The training, if you go online to Pet Partners and you can look up the qualifications for a pet dog, but it's all those things for a therapy dog. It's all those things I listed. The biggest thing is your dog has to, and I mean, the hospital has 27 Goldens right now. We had 34 at one point. That's by far the most popular therapy dog. The most important thing is, they can't bark, and they can't, they have to be like, kids got kind of like sometimes pull their, I mean, some of these children can't help it. You kind of guide the child's hand, but you don't know what a child might do. But Goldens are just awesome. But if you go online to Pet Partners, you can see all the qualifications. And you can also call Children's Hospital and ask for the dog therapy program, and they will connect you to, they do testing at Children's Hospital for Pet Partners.
Okay. And then someone wrote in the chat that they got their book today, and that they're getting a border doodle, and they were wondering if that would work as a therapy dog.
Listen, any kind of dog can work as a therapy dog. Half the dogs at Children's Hospital are rescue dogs that are therapy dogs. And like I said, a dog can start at any point. It doesn't matter if a dog tests when they're 7 years old. Some dogs don't calm down until they are a little bit older. It all depends on the dog's personality. So listen, there is no dog that can't be a therapy dog. And I should have clarified one thing. When I listed Golden Retrievers, Labs, and German Shepherds, those are the most common dogs for service dogs. I mean, I hope you understood that. Not therapy dogs, but service dogs. There is every type of dog at the hospital. There's even a pit bull as this therapy dog at Children's. Because I'm going to be honest, I was surprised. I was a little surprised when I first saw the dog. But if it passed its test and it's a wonderful dog, there's nothing restricting it.
Mm-hmm.
That's neat.
Yeah, so I mean, but half of them truly are rescue dogs. So they're mixed breeds. And it's really great. We have one dog at the hospital that's blind, and we have one three-legged dog, which the kids can really relate to. I mean, it's great. It's great.
Yeah. And then did you say Pet Partners has trainers? Someone asked, they said their dog is 5, but he's still like a puppy and has a hard time. They have a hard time keeping the dog from jumping on them.
On jumping on them. You know what? Oh boy, as soon as Griffith Park, that I have to be honest, I have never, if I ever get another dog, I will definitely go to Griffith Park for the training. They aren't open right now. I'm going to give Rachel the contact information for Griffith Park dog training because it's fabulous. I mean, I can't even tell you. If you have, I think it's 8 or 10 classes initially. And if your dog doesn't pass, you can keep going for free. And it's like only like 110 for the classes anyway. And the great part is there's like 20 dogs there. And they will teach you, if you have any problem with your dog, like jumping on you, those guys know what to tell you to do. I was having trouble getting Blondie to lay. And they told me I needed to grab right here under her collar and just pull down as I said lay, but pull forcefully down. They're just wonderful. They can work through any little thing you have that your dog is doing.
And then someone asked if a dog could be both a therapy and a service dog.
That's a good question. I would assume absolutely if they pass a therapy test, because it would be great to have a special needs person volunteering at the hospital. So I don't see any reason why not. I mean, a service dog is, super, super well trained. They would just have to pass the therapy dog test.
Okay, and then someone else asked if they could still pick up the book at CSC Pasadena this week. Yes, you can. We will have the books out on the front bench outside of our office, and we're open from 8:30 to 7, Monday through Thursday. And someone wrote that they had a PAT program that they were interested in a while back, or HMH. Is that Huntington Memorial Hospital?
Yep.
So then they wrote one of the requirements was no skin issues, not even just allergic rashes. My dog, who was my lifesaver and discovered my cancer, had skin allergies, tested negative several times for managing other conditions, but could never get into the program.
See, if the dog's taking, I don't think skin allergies would prevent the dog. We worked also at Huntington for a year, but Blondie Blondie loved being with the children, and Huntington was a little more restrictive. I mean, children's, you sign up online, you can go when you want to. You're just on different floors all the time. It's not the same old. And at Huntington, we are always kind of on the same floor. If the dog's not on medicine, the skin issues shouldn't be a problem.
Okay.
If a dog gets a Cytopoint shot, that is not considered medication. A Cytopoint shot is done just to help prevent a breakout from allergies and things. And the Cytopoint shot may be the cure for the skin, but that is not, your dog can have Cytopoint and be at the hospital.
Okay. Yeah, this person wrote that Huntington Memorial Hospital's pet-assisted therapy program was very restrictive.
I think it's a little more restrictive than children's.
Okay.
Yeah, I think it really is, but how you look at children's, my dear, so good. But I mean, other hospitals are too. I know Verdugo has a wonderful program. I know Cedars-Sinai has a wonderful program. A lot of hospitals have great programs.
Great. And then someone else wrote that they had to leave, but they hope that when their sister goes back to the hospital that she can see Blondie.
They ask her, but all they have to do is ask, and they will call me.
Oh, great.
Yeah, they're very, yeah. I get calls, to come for certain things.
Mm-hmm.
Absolutely. And whenever Blondie has to be in neurology, we always get calls because the parents want a certain dog.
Awesome. And then someone else asked, do you do other therapy aside from hospital visits? Yeah. Do you do other therapy aside?
Oh yeah, we've gone with the firefighters when they at their base stations during the big fires. We've gone to evacuation centers. We've worked a lot with autistic children. We go to a ranch for special needs children. I've gone to the library a few times, and then I go to the nursing home. The catch is, if you have a dog, it's endless, the places that you're wanting. And it's just so rewarding. I mean, it's so rewarding. And all you get are thank yous. I mean, and you have to laugh about our dogs in costume. I mean, Luke, Luke, as long as somebody has their cell phone out and is taking his picture, he will wear a hat and sunglasses or anything. The minute all the cell phones go down, he knocks his hat off. Now Blondie doesn't care. She just kind of wears hers all the time. He's definitely a camera boy. Sometimes, we've had times when we go in costumes and they're dressed alike, and like before the Super Bowl, we always change the name of the team on the side and what have you. I mean, it's taken us an hour to get through the lobby. Staff call other staff, and you got to come down. Blondie, we have a new costume. And I mean, it just makes people happy. And they all want to pose for pictures with the dogs. It's fun.
It's so fun. And then someone also wrote that there's a reading program at the local library where kids read to the dogs. Do you think that this is the same training that's needed for that?
There's Love on a Leash, which is a group that they don't go to hospitals, they go to libraries, and they go to special needs places, and they can go to evacuation centers. Love on a Leash is not as restrictive as going to a hospital.
Okay.
But Love on a Leash is another great organization. You just won't be going to a hospital with Love on a Leash. You'll be going to schools. You can do all kinds of things, just not the hospital setting.
Okay.
The hospital setting is just a little bit more restrictive.
Okay.
But I mean, one of the great things about children's compared to Huntington is they let our dogs wear costumes. It's so fun to dress up the dogs and have so many people happy. I mean, it's just great.
Absolutely. And then lots of people have been writing thank you to you in the chat. And then someone also wrote, thank you so much for sharing your adventures with Blondie with us. And then someone else asked if it was possible to borrow a day for an hour, like Blondie services for a day or an hour at a time. Is that something that you do?
Sure. Blondie could definitely come. Absolutely.
Okay.
Absolutely.
And
I'm happy to do my presentation for any group that you might think might enjoy it. I mean, it's good. And once a child's 18, they can volunteer at the hospital. I've talked to a number of teenage groups And the great part is we've gotten 6 new teams from people listening, which is wonderful. We always want more dog teams. You can't ever have enough. You can't ever have enough.
That's great. Someone also wrote into the chat that they had therapy dogs visit Camp Keepsake a few years ago.
I've never been to Camp Keepsake. That's one place I have not been.
Well, everyone, please feel free to type your questions into the chat or unmute yourselves if you have any questions for Rose.
And if you want a book, please let Rachel know, and I'm happy, just give her your address. I'm happy to mail one. And I'll also give her the address of the trainer at Griffith Park. Because
Okay.
I just believe in their training so much. And I think group training, your dog has to learn to behave around other dogs, different sizes, just everything. And sometimes it's hard for other dogs to, meet big dogs, little dogs, whatever. It's just a great program.
Great.
Thank you. It was amazing. I have a cat, but I love dogs. And so, I mean, I was crying through all of it. I should have unvideoed myself, but it was so beautiful. And I just thank you and applaud you for what you and Blondie do for the world. It's
You're so
amazing. So
we get more out of it than we give. We truly do.
Well, I hope when this COVID ends that we get to meet Blondie in person.
Oh yeah, she's so precious.
Good. I would like that.
And you'd also love Luke. I mean, he's adorable.
Yeah, the more the merrier.
He's coming down to see Blondie on Friday. On the night. They live an hour apart, so they don't get together very often.
Perfect marriage.
Perfect. Yeah.
Someone asked how old Blondie is.
Blondie's 8.
Okay.
Blondie's 8. And Rachel, if you want, I can bring a stack. I should have brought it. My husband. I could bring a stack of cards over, Miranda, of Blondie cards, because kids like those. And if you have grandchildren, if you have grandchildren from 2 different families, get 2 books. I mean, please don't. Okay.
Great.
Guide.
Wonderful. Okay, yeah, Rachel left the call, but I will communicate all of this to her.
Okay, it's a great book for 4 to 6 year olds, I would say.
Oh, great. Okay, yeah.
I mean, 2 to 6 year olds. 2 to 6 year olds. Like 3 and 4 year olds really get into it.
Awesome. Wonderful. Okay, well, if those are all of the questions, we just wanted to thank you, Rose. This has been such a wonderful program, and we've loved learning about all the adventures that you and Blondie have had. So thank you so much.
Okay, you take care, guys.
Thank you. And just a quick reminder that there will be part 2 of this program next Monday at 5 p.m.
We're going to have Miss Blondie.
Yay.
Wonderful. Thank you so much, Rose.
Thank you.
Okay, bye-bye.
Thank you. Bye.